Group at CHI Memorial. Great to have you here this morning.
Thanks for having me.
And with October being Breast Cancer Awareness Month, we have kind of just dedicated this whole show, it seems like today, of talking about breast cancer and raising that awareness. It sure is. And so we definitely wanted to have you on to talk today, especially about a new technique that CHI really prides themselves on, and that you have just really been, I guess, the pioneer for this. So talk to me a little bit about what is called the hidden scar technique.
So the hidden scar technique is a breast cancer technique which preserves the entire shape of the breast. Mm-hmm. And the whole thrust of it is, and the whole thrust of all of our reconstructive techniques are to make you look after you've had a cancer surgery like you had cosmetic surgery. Mm-hmm. So the incision for the hidden scar technique is in the crease that lies between your breast and your abdomen. So hopefully and ultimately it looks like you've been hardly touched at all.
Right. And who would be a good candidate then for this?
So of course, increasingly now there are a lot more women that have genetically positive risk factors for breast cancer. Certainly those women, because those women come to that decision in their early 30s. They typically have good breast shape at that time, and we can do a risk reduction procedure and a reconstruction which looks like you've had cosmetic surgery, so you have great aesthetic preservation. It can also be applied to women that have breast cancer, dependent on, of course, the position of the tumor and what the oncologic surgeon says they can do.
Right. And I was asking if you had seen an increase in this over the past few years. We've had a few celebrities that have spoken out and have gone public with their decision.
Yes. And they certainly drive awareness. Yeah.
Yes.
So yes, the incidence of mastectomy is increasing because I think just because of the awareness of breast cancer, the awareness of the genetic problems that you can have, but also I think that because of our capacity to really bring you a product that looks great when you're finished with it.
And your team, you're part of a team that are specialized in this. Are you the only one in our area, and perhaps maybe even
I think we're the only team of hidden scar technique surgeons, and I helped develop the hidden scar technique curriculum for plastic surgeons.
Right. Okay. Well, wonderful. Well, this is certainly, just for women, I guess, just to give them that added confidence. And you and I chatted off camera, and you said, it's so wonderful when you do see a young woman that is able to go on vacation and, wear the bathing suit.
So the other day was my birthday, and I was flipping through my Facebook little birthday greeting things, and one of my patients sent me a birthday greeting, and she sent it from the beach, and she was in her bikini. You can't beat that.
Right, exactly.
So she's back to where she was, and
giving her that confidence to move forward as well. So great. And also, I guess where you practice, I know Chip is going to join us. We're probably going to keep you around to the D block if you have just a few minutes, if you're not in a hurry to get back, because you've done some work for him recently with an injury. So tell people how, if they still have questions for you, want to know if they're a good candidate for this.
Yes, you could come see us at I'm at the Plastic Surgery Group. We have a website, refinedlooks.com. You could also search the CHI Memorial Reese Skillern Cancer Center, the Mary Ellen Locher Cancer Center.
Right, great. Well, thank you so much for being here, and if you can, stick around with us.
I will.